Welcome to part two of the endocrine system. This is the second and final segment of the endocrine system. And this is where we talk about how the endocrine system has a fantastic impression on the human body. In other words, it is in charge of growth and development and making sure that every single day our bodies have a homeostatic balance occurring. Last part, we talked about some general organs, some methods of the endocrine system, and then we started going through some of the glands and hormones of the endocrine system. So last class we focused on pituitary gland and some of the effects of hormones that it releases. In this section, we're going to keep moving through endocrine glands all the time. Keep in mind we're thinking about what is the gland, what hormone or hormones does it produce, and what is or what are the effects of each of those hormones. So continuing on with review, this is showing some of those glands that we'll go through today. And last time we talked about how the hypothalamus and the pituitary are sort of almost a sort of quote-unquote master gland. And perhaps that is expressed nicely today. We see how these glands produce their own hormones. So let's go in depth now and talk about continuing our tour through these. In last section, we talked about thyroid gland. We had discussed how anterior thyroid gland emitted its own hormones, and then that's going to influence, it's going to put influence upon thyroid gland. So let's back up a little bit and take a quick review. Recall that thyroid gland is a nice big organ devoted entirely to endocrine activity. And recall that it's going to have the job of increasing metabolic rate, and it's going to have an increase in body temperature. And again, just kind of going through some gross anatomy, notice how this thyroid gland is located immediately inferior to that thyroid cartilage. You can possibly find that thyroid cartilage, just palpate your throat region and try to track down that Adam's apple, that protuberance, that thyroid protuberance, so to speak. Anyway, if we go down from that, we see that anterior to the trachea, it is going to be covered by a connective tissue capsule, and this thyroid is composed of left and right lobes that are connected by an isthmus, so to speak. It would be tempting to palpate this gland, but it is actually typically covered up by muscles like sternocleidomastoid muscle. But the idea is that this thyroid gland is composed of numerous microscopic spherical structures, and these are going to be called thyroid follicles. In other words, follicle cells. Well, let's take a closer look at this thyroid now. We see the function of these thyroid glands is going to be produce thyroglobulin, and that intermediate molecule is used in the synthesis of thyroid hormones T4, that is thyroxine, and then T3, that is triiodithionine. Well, let's see. It's these follicular cells that are going to produce and release thyroid hormone. And then after we release it, we synthesize it, we're going to put that into the colloid fluid. And so one interesting substance that's important is the presence of iodine. Iodine must be combined with TGB, thyroid globulin, to produce the precursors for thyroid hormone that are stored in the colloid. So in other words, iodine is an important ingredient that we should have in the human body. You might notice that it's very common for table salt to be reinforced with that essential iodine nutrient. Well, upon stimulation of that thyroid gland, the thyroid hormone precursors are internalized into a follicular cell, and then that thyroid hormone is sort of cleaved off of that thyroid globulin cell, and that's going to occur by lysosomes, and then once they're cleaved off, they are released into that bloodstream. It is noteworthy that we are also releasing calcitonin thanks to these thyroid glands as well. These are going to be released in parafollicular cells. And calcitonin has the responsibility of building up bone and stopping reabsorption of calcium. So in other words, we're going to lower blood levels of calcium by putting that calcium into the bone. And notice that this function of calcitonin is quite dramatically different from the T3 and T4 molecules. These thyroid hormones, what we mentioned previously, are going to be involved with metabolic rate, breakdown of fats, use of glucose for ATP production, where we see that calcitonin is actually working with calcium levels in the bloodstream. In a few minutes, we'll talk about parathyroid hormone. Actually, we talked about we are going to talk about parathyroid hormone. So calcitonin is going to work antagonistically with parathyroid hormone. We'll talk about that in a short few. But in summary, calcitonin is going to store calcium in the bone, and therefore, when it takes calcium out of the bloodstream, it's going to lower the levels of calcium in that bloodstream. Let's take a quick detour and look at some homeostatic imbalances involving the thyroid. And the first one on top is showing hypothyroid syndrome. That is going to be a lack of iodine. That's going to produce something called a goiter. And a goiter is an enlargement of the thyroid, and that's typically due to an insufficient amount of that dietary intake of iodine. And so this hypothyroidism results in decreased production of thyroid hormone, and that's going to be characterized by a low metabolic rate, lethargic tendencies, feeling cold, weight gain. Those are all symptoms of hypothyroid syndrome. Well, since the prefix hypo means below or lesser than, the opposite of that is hyper, and so we might get a homeostatic imbalance called hyperthyroidism. And that's going to result from the excessive production of thyroid hormone, and that's going to cause an increase in metabolic weight, increase in metabolic rate, weight loss, hyperactivity, and heat intolerance. One potential extreme case of hyperthyroidism is Graves' disease, and that's a form of hyperthyroidism that's caused by the loss of feedback control by the thyroid itself. And what it does is it produces exophthalmos. That is, in other words, a protruding and bulging of the eyeballs. This slide, it just kind of comes back to control of T3 and T4 molecules. Let's see. So perhaps we mentioned earlier that this hypothalamus releases thyrotropin releasing hormone that is called TRH, and that TRH is going to enter that hypothalamo-hypophyseal portal system. What happens then is the TRH is going to bind to receptors in the anterior pituitary gland, and that's going to stimulate the release of thyroid stimulating hormone, and that's abbreviated as TSH. After that, TSH is then going to bind to receptors in the follicular cells of the thyroid, and that's going to stimulate the release of thyroid hormone in the form of both T3 hormone and T4 hormone, which are released into the circulation. The end result is this TSH is going to stimulate the gland to raise the levels of this hormone in the bloodstream. Okay, let's take a look now at the parathyroid glands. And this term para kind of means opposite of. So notice how parathyroid is on the opposite side of thyroid gland. So in other words, we're not looking at the anterior view. We are looking here at a posterior aspect. And these parathyroid glands are about the size and shape of raisins. And there's a histology image of these glands on the right. And there's a couple different kinds of cells in here. The chief cells of parathyroid gland produce parathyroid hormone. And then there's these cells called oxyphil cells. Their function is unclear. But let's take a closer look at the homeostatic balances of this parathyroid gland. So as we said earlier, the anterior portion of this gland, the thyroid, produces calcitonin. And then the posterior portion has parathyroid glands that's going to produce PTH. And so these two hormones are going to work antagonistically. And so together they're going to function to regulate calcium levels in the bloodstream. So let's take, for example, we have, we'll start, let's see, where should we start? We'll start right about here in the diagram. Notice that we are seeing, let's see, oh, here's a good diagram. The red dots represent calcium ions. The purple squares represent parathyroid hormones. So here we are secreting parathyroid hormone in the upper right-hand corner. Notice these are coming out of parathyroid gland. Notice how they enter bone. And when this hormone enters bone, it activates those osteoclasts to put that calcium into the bloodstream. So we see that happening here with those red dots. Notice that parathyroid hormone is also going to have an impact on kidney, and it's also going to have an impact on intestine. But let's be clear that most of the effect of PTH is going to be on the bone portion. We're, again, working antagonistically with calcitonin. All right, we're moving through the endocrine system and looking at some organs. We now arrive at the adrenal glands. And we talked a little bit about adrenal glands last class. Notice with some gross anatomy, again, as we mentioned, these adrenal glands are anchored on the superior surface of each kidney. And if we looked into a cross-section view of that adrenal gland, we would see two main regions. There's an inner region called the medulla, and that region is going to secrete catecholamines called epinephrine and norepinephrine. And then there's an outer region called the cortex, and that's going to be partitioned into 4 zones. So let's take a closer look at those 4 zones. Before we go into the zones, it's noteworthy that this adrenal gland has a capsule on the outside. That's going to simply just kind of be the outside container and protector of that gland. And then we arrive at our most superficial zone, this zona glomerulosa. And that's going to synthesize mineralocorticoids. And the principal mineralocorticoid is going to be aldosterone, and that's going to regulate sodium and potassium ratios in the bloodstream. Moving in a little bit more deep, we arrive at zona fasciculata, and that's going to synthesize glucocorticoids. Mainly, we're talking about cortisol and corticosterine. And then we arrive at zona reticularis. Zona reticularis is going to synthesize gonatocorticoids. Primarily, we're talking about androgens here. And we'll go more in depth into these hormones in a short few. And then we arrive at a dividing line, sort of a divider between cortex and medulla. And here at this medulla, here's where we're going to be secreting those catecholamines, norepinephrine and epinephrine. In other words, giving ourselves a fight or flight response. Well, let's take a closer look now. Let's take a closer look at these mineralocorticoids. So let's back up here a second and note that we are here in the zona glomerulosa, this sort of thin outer layer of the cortex of the adrenal gland. And they're going to be producing these mineralocorticoids, and they have the function of regulating electrolyte levels. And we're looking at one specific one of these mineralocorticoids, and that is aldosterone. And that has the function of increasing the reabsorption of sodium. So let's take a look at that on the bottom. I know there's a lot of semantic noise, so to speak, in this diagram. Notice that we're just looking at the main function as being the absorption of sodium. In other words, that's going to result in a reduction of sodium loss. So how are we going to lead to that? Well, there's multiple ways of doing that. We can see that a decrease in blood volume can trigger that, or an increase in potassium levels in the bloodstream. Stress can influence it, and then also blood pressure can influence it. So it's rather complex, but for simplicity's sake, just understand that the zona glomerulosa is going to secrete aldosterone, and that's going to foster sodium retention and then also potassium excretion. Like many things in the human body, we get homeostatic imbalances. So sometimes we might, let's say, get a tumor in this adrenal gland. We might get hypersecretion of this aldosterone. So that might lead to aldosteronism, and that's going to be a high blood pressure caused by too much retention of sodium and water in that bloodstream. All right, moving down the layers of the cortex, we arrive at our glucocorticoids. And our glucocorticoids are going to be hormones that regulate blood sugar. And we're going to focus on cortisol at this one. Notice how cortisol has the function of increasing blood sugar. So that's going to help keep our glucose levels constant. And sometimes we call cortisol the stress hormone, so to speak. In other words, if we get stressed out, we release cortisol to hopefully reduce that stress. And we can provide resistance to that stress by making nutrients available for ATP production. As all things, we sometimes get a homeostatic imbalance, a hypersecretion. A good example of that is Cushing's syndrome. And then if we're producing too little of that hormone, we might get hyposecretion, Addison's disease. All right, well, we're moving down through the cortex layer of the kidneys, and we're now in the zona reticularis, a thin inner layer of that cortex. And the function of that region is to produce gonadocorticoids. And the one specific focus of these gonadocorticoids is going to be the production of androgens. Androgens are termed male sex hormones, but keep in mind that females also have certain levels of androgens. These androgens can be converted into testosterone or estrogen for females. Well, we have functions for these. The function of these androgens is going to give us an onset of puberty, and then also the appearance of pubic hair or axillary hair, armpit hair in other words. In addition, it also influences our sex drive. Production of estrogen after menopause is affected by androgens as well. It is noteworthy that the amount of androgen produced by the adrenals is less than the amount from the testes. Like all things, we sometimes have homeostatic imbalances. Hypersecretion can result in androgenital syndrome. Okay, and now we are out of the cortex. We now arrive at the medulla region of the adrenal glands. So that means we're looking at the inner region of the adrenal gland, and these are going to secrete hormones called catecholamines, and two specific ones of interest are epinephrine and norepinephrine. They're just kind of cousins of one another, similar structures, most of them being epinephrine. The function of these are short-term stressors cause a fight or flight response. We might recall that this is called a sympathetic response as well. And notice that this is shown on the picture. So we're only looking on this picture on the left side of it, only under short-term stress. So we see that stress is coming out of the brain, hitting that hypothalamus. A nerve impulse is coming through the spinal cord and sending a sympathetic impulse to the medulla region. And that's going to signify it to produce these catecholamines. And these have a fight or flight response. We're talking about increased heart rate to fight the perceived threat. We're talking about increased blood pressure to maybe run away from that threat. We're taking stored glycogen and converting it into glucose in the bloodstream so that we can fight or flee from the perceived threat. Again, a fight or flight response. We can have a homeostatic imbalance, a hypersecretion of that, hyperglycemia, that's going to be elevated glucose, and uncontrolled sympathetic activity. Now, in contrast, on the right side of this diagram, we see more prolonged stress. That's going to go through a slightly different pathway. That's going to happen there at anterior pituitary gland. We're going to be secreting ACTH, and that's going to be working with the cortex region. And earlier we talked about mineralocorticoids and glucocorticoids dealing with a more longer, prolonged stress. But again, the quicker fight or flight response is done with the short-term response. That's done in the medulla region of the adrenal glands. Okay, we are starting to round out our journey through the endocrine system, and now we arrive at the pancreas. And this is one of those organs that has both exocrine and endocrine functions. So here we see the pancreas is located right above the duodenum. We talked about the digestive system, how pancreas is going to be secreting a broad spectrum of enzymes to break down a broad spectrum of fats and carbohydrates and also lipids as well. Okay, well, let's see. This pancreas is a sort of organ that's, as we said, around the small intestines and the spleen as well, directly posterior to the stomach. And yeah, this mixed gland has mostly what's called acini cells. Let's see if we can get a picture of that. There we go. These are going to be these outer cells. These acinar or acini cells surround a small duct. And the idea behind these mostly numerous acini cells is they're going to be involved in exocrine activities. In other words, these are the cells that are producing that alkaline pancreatic secretion that's going to aid in the digestion that I just talked about. Well, scattered amongst all these Acini cells are going to be little islands, so to speak, pancreatic islets. And these are going to contain alpha cells and beta cells. The alpha cells secrete glucagon, the beta cells secrete insulin. And hopefully you can see these structures in the histology image above. Well, we see that the purpose or function of having glucagon and insulin in the human body is to regulate blood glucose. And this is another one of those hormones that we might call antagonistic. All right, let's go ahead and talk about that. We see that this is targeting the liver. And we want blood glucose within a normal range. In other words, we want about 90 milligrams of glucose per 100 milliliters of blood. We'll start out with the top part of the diagram. Hopefully you can see we are leaving that balance, that normalcy. We have rising blood glucose levels. Perhaps maybe someone ate a large amount of sugary foods. And the target organ is going to be, I'm sorry, not the target organ, the endocrine gland is going to be pancreas. That's going to secrete insulin. So insulin is released from the pancreas following food intake. And the idea is that chemoreceptors in the beta cells can detect an increase in blood glucose. Well, we see that insulin travels over to the liver, and that insulin is going to stimulate glycogenesis in those hepatocyte cells. It's also going to instigate lipogenesis in adipose connective tissue, and it's also going to increase the uptake of amino acids and glucose by most cells. So then, if we are uptaking that glucose and absorbing it, we have sort of taken that glucose out of the bloodstream, and therefore it falls back to a normal range. Well, let's look at another homeostatic imbalance. This is where we have decreasing blood glucose levels. Perhaps someone skipped a few meals, etc. This is going to have decreasing levels. Once again, pancreas kicks in. Well, since this is a sort of negative feedback loop, we're going to see that glucagon is then going to get released from the alpha cells in the pancreas. And again, that's in response to a detection of low blood glucose. So glucagon has the effect of raising blood glucose levels. That's going to stimulate glycogenolysis. In other words, we're breaking down that glycogen, and this is happening in the hepatocytes, and it's basically releasing the glycogen and breaking it down, hence putting glucose into our bloodstream. So basically, glucagon is going to raise blood glucose by stimulating that breakdown of glycogen in the liver. And once we get that glucose back into the bloodstream, that's going to raise us back to normal blood glucose levels, again having a homeostatic balance, so to speak. As all things in the human body, things can go wrong, and we do have a homeostatic imbalance of the pancreas. Diabetes mellitus, is a metabolic condition, and that's going to be marked by the inadequate uptake of glucose from the blood. There's many unfortunate problems with diabetes. The leading cause of blindness in the retina. Diabetes can lead to kidney failure, and then sometimes also leg amputation as well. So we have two types of diabetes. We have type 1 diabetes. That's also called insulin-dependent diabetes. That's because the deficiency of insulin is happening. So we have if we have diminished production of insulin, this is then going to require daily injections of insulin to keep up with those blood glucose levels. The other type of diabetes, type 2, is sometimes called insulin independent. And that's caused by decreased insulin release or maybe decreased insulin effectiveness in peripheral tissues. So these peripheral tissues have insulin receptors that are apparently not functioning very well. Another effect of diabetes is excessive urine production, excessive thirst, and excessive eating as well. And another homeostatic imbalance of the pancreas is hyperinsulinism. Insulinism, that's when too much insulin is present. That could possibly cause hypoglycemia, which is a lower amount of glucose in the bloodstream. We are just about to finish up our discussion on endocrine organs, and we arrive now at the ovaries and testes. And these have the function of secreting sex hormones. You might recall earlier that these ovaries and testes are influenced by follicle-stimulating hormone for reproductive purposes, but they also are influenced by luteinizing hormone, which is going to influence their hormone production. So let's look at some of the hormones that are produced by ovary. Some of the common ones are estrogens and progesterone. We'll talk more about these in the reproductive system. The idea behind these is they promote development and maintenance of secondary female sex characteristics. So we're talking things like larger breasts, development of labia in the vagina, etc. In addition, there are other hormones produced by ovaries, one called relaxin. Yes, there is actually a hormone called relaxin. That's going to increase the flexibility of pubic symphysis during pregnancy. You might recall that that's a piece of cartilage that runs between the coxal bones and the hips. And then also, ovaries are going to produce inhibin. That's going to inhibit the secretion of follicle-stimulating hormone from that anterior pituitary. So once again, we see the effects of a negative feedback mechanism in this endocrine system. Well, the function of these testes are also to produce sex hormones, but these produce a special kind of hormone, testosterone. So testosterone is going to stimulate the descent of the testes before birth. In the reproductive system, you might recall that the testes descend from the abdomen out into the scrotum. This testosterone is also going to regulate spermatogenesis, in other words, the creation of sperm. And when we say development of male secondary sex characteristics, we're talking about things like deepening of voice, and we're talking about maturation of sexual structures, post-puberty structures. And in addition, these testes produce inhibin, and just like the ovaries, these inhibit the secretion of follicle-stimulating hormone from that anterior pituitary. It is interesting to kind of think that in reproduction and pregnancy, this structure called the placenta in female anatomy is really just a temporary endocrine organ. It's just kind of food for thought. Well, only two more to go. Thymus gland. Here we go with thymus. And, well, thymus is a bilobed organ. Perhaps you can see it in that image. It's located anterior to the heart on its superior aspect. Interestingly, this thymus is large as infants. Then it continues to grow until puberty, and then after that it regresses in size. And then as we're senior citizens, it's quite small and shriveled up and not very functional. Well, this thymus is going to secrete thymic hormones. hormones such as thymosin, thymulin, and thymopoietin. These are going to assist in the maturation of T lymphocytes. So you might recall from the immune system, those T lymphocytes do their immunity jobs thanks to the maturation caused by the thymus. And then lastly, we talk about the pineal gland, our last endocrine organ. That has the function of secreting melatonin. And this little guy is sort of a little bit of a mystery, but we do know that it does have some influence on our biological clock, so to speak. So to find this gland, we would need to jump back into the brain. This is a small gland attached to the third ventricle of the brain. And it's just right around the posterior portion of the diencephalon region. Well, if we looked in there, we would see a small cone-shaped structure. And by the way, that's how it gets its name. It's pine cone-shaped, pineal. And as we said earlier, that secretes melatonin. And melatonin is responsible for kind of quote-unquote setting our biological clock. And so this melatonin production tends to be cyclic. That is, melatonin production increases at night and decreases in the day. We have the lowest levels of it around lunchtime. And it's going to help regulate this circadian rhythm. So let's talk about that. We notice that if we're exposed to a high amount of light, well, that gets picked up by pineal gland, and that decreases the amount of melatonin, but the decrease of melatonin actually causes us to be awake. The opposite happens in darkness. In darkness, pineal gland then secretes a higher amount of melatonin, and that higher amount of melatonin makes us sleepy and helps us get to sleep. Jet lag can affect pineal gland's function, usually in a negative way, but SAD treatment, bright light, can typically influence it in a good way. This is important for us Alaskans since we do not get a whole lot of direct sunlight for months out of the year. So some people like to have artificial lighting to help them establish these natural circadian rhythms. And other persons also manage their electronic devices wisely. So it's a good idea at the end of the day to sort of dim down your lights and help your pineal gland produce melatonin to assist you in going to sleep. Okay, lastly, there are just sort of other hormone secreting organs, kind of general, small organs that secrete hormones. So let's look at a few of these. Take, for example, the heart. The heart is going to secrete atrial natriuretic peptide. You might recall from the cardiovascular system that this hormone functions to control blood volume and blood pressure. You might also recall that the kidneys are going to secrete erythropoietin, and this is going to stimulate red blood cell production in the bone marrow. We talked about that in our first week of class. Let's see, in addition, the stomach secretes gastrin, small intestines secrete secretin, and it's noteworthy that the skin is involved in production of vitamin D3, and that vitamin D3 gets secreted into the bloodstream and assists in the control of blood calcium. So once again, that's a big issue for us Alaskans since we do not get a lot of sunshine on our skin, because that's what drives the manufacturing of that vitamin D. Well, lastly, we have a table that summarizes these hormone activities. Again, as I've stressed a couple times, remember, focus on your gland, what hormones it produces, and the effects of those hormones. So that does it for endocrine system. Thanks for sticking with me. We'll see you for the next system in the human body.